Good morning. I call to order the August 24th San Francisco Human Service Commission meeting to order. It is now 9:35 a.m. I'm Scott Kahn, the Human Service Commission president. The commission secretary will take the roll call, then we'll provide comment for public and remote access.
Please note that Commissioner Singh has an excused absence, so there will be no commissioner attending remotely. Please say here for the record, President Khan.
Here.
Vice President McCray, I think he's just late. Commissioner Copeland McDonald. Commissioner Semmel. We have a quorum. Okay, now I'm going to quickly try to explain how public comment works in this hybrid commission meeting environment. Public comment will be available on each item on this agenda and during general public comment at the end of the meeting. Each speaker will be allowed 3 minutes to speak. The public is attending this meeting in person in the Horn Auditorium and remotely via WebEx and the phone. During each public comment period, you will first address in-person comment, then WebEx attendees, then phone attendees. For in-person public comment, please fill out a yellow public comment card available at the back of the room and bring it to me. It's not required, but it helps me organize public comment. For WebEx attendees wishing to provide public comment, you will be instructed to use the raise your hand feature when I announce public comment. The meeting moderator will call on you when it's your turn. For phone attendees wishing to provide public comment, when your item of interest comes up, dial *3 to be added to the speaker line, and then wait for the prompt before speaking. The phone number for this meeting is 415-655-0001. And then the passcode is 2661-201-5992. And then just press pound. When connected to our meeting via WebEx or phone, you will hear the meeting discussions, but you will be muted and in listening mode until public comment is open and you raise your hand or enter *3. If you run into any issues, you can try calling my cell phone or texting me, and Abhishek and I will figure this out. 415-535-2386. Thank you, President Khan.
Item 3 is the adoption of the agenda. Are there any comments or questions from the commission regarding the agenda? Is there any public comment? Hearing no request to speak on the item, is there a motion to approve item 3, the agenda?
I'll move. Second.
All in favor?
Aye.
So moved.
Half page 4 or 6 of the agenda. Oh, that's not. Took me a while. You don't have to move. It's 6.
Yes.
Thank you. And shares. You read this.
You don't need it today?
Yeah,
I'll hand you.
yeah, I don't know that I. You did.
Item 4 is the adoption of the August 1st regular meeting minutes. Are there any questions or comments from the commission regarding the minutes?
No.
Hearing none, is there any public comment? Can I ask for a motion to approve the minutes?
So moved.
Second, all in favor? So moved. Item 5 is the executive director's report. Calling on Trent.
Morning, President Tom. Nice to see 3/5 of you. Okay, starting at the state level, September 14th, so a few weeks from now, is the last day for the legislature, easy for me to say, to pass bills and go to the governor's desk, and the governor has 30 days to sign or veto the bills. We're tracking several bills that we're supporting that we're hoping we'll get through. One in particular is one that we sponsored, or the County Welfare Directors Association sponsored, Senate Bill 408. And 408 has been scaled down significantly. It was a larger bill that had a whole series of a whole set of initiatives and funding for needs of foster youth who have really acute mental health and behavioral health needs. It was scaled down mostly due to costs. The current version that's in assembly at Probst right now, and it seems to have full support of the legislature, will establish 10 regional health teams throughout the state to serve foster youth. As you know, we place kids not only in San Francisco, but also in the East Bay, Sacramento. So regional health teams will help coordinate mental health care for foster youth who are not in their county of origin. So we're hoping this gets through, that the governor signs it. And then so as we look forward to the next legislative season, we typically solicit bill proposal ideas from staff, sometimes from our community partners and other counties. And we staff meet in October, November to set the agenda for the following year. I did actually have an opportunity in Sacramento yesterday to meet with Assemblyman Ting, who committed to authoring a bill that he authored this year, which is to allow undocumented residents in the state to be IHSS providers for their families, which is really a way to address a provider shortage we have in IHSS, as well as to get income into the household of undocs who don't have a legal path to work currently. But this sort of the first year of the bill this year, we worked through a lot of the legal issues, and we're hoping that it moves next year. And Assemblyman Ting agreed to champion it again. At the federal level, Congress is in recess. They'll come back in early September. What's hanging out for us are the appropriations bills. It looks like there's not going to be any change or any action before the end of the federal fiscal year at the end of September. So we're looking at most likely flat or level funding for our programs. We have been tracking the Farm Bill, which is the bill that authorizes our federal SNAP, but locally the CalFresh program. There's been, and I've mentioned this before to you all, a lot of talk, particularly among Republicans in the House, of increasing work requirements even further for CalFresh and for SNAP. But the House Ag Chair has really been resistant to the House Agricultural Committee, where the Farm Bill would go to be vetted, has been fairly resistant to the changes because with the Deficit Reduction Act that passed 3 months ago, there are increased work requirements already for CalFresh up to age 55 instead of 50. So he's resistant to go further than that, although Republicans to the right of him are still pushing. So we'll continue to track that. It's likely to be probably introduced in November. So the title of my note says "End of an Era," and the era I'm talking about is our COVID response. And so we have finally closed our books for our accounting books for COVID. And I just want to bring to your attention the scale and the magnitude of what we did as an agency under COVID. So in the end, from March 2020 to July of 23, the Human Services Agency spent a total of $511 million on the COVID response. That's just our agency, $511 million. 95 to 96% of which is reimbursed by federal or state sources. FEMA representing the largest at about $322 million. State funding is accounting for about 120 million, and then there's dribs and drabs from HUD and other sources. I think more interesting is what we spent the money on. We spent $265 million $265 million simply on renting hotel rooms, just the rent for over 3 years. $65 million to demobilize the hotel, so that's repair, settlement costs with the hotel owners. Another $55 million in the SIP hotel system on non-room rental costs. So this is services. I think food is probably wrapped up into that and other items. In the congregate shelter side, $7 million. Our trailers out at Pier 94, $2 million, and then our food programs overall, many of which continue today, we spent $117 million. So $500 million in COVID response just in this agency, citywide, probably 3 times that. Again, with the bulk, about 95% being reimbursed through either FEMA or state sources. So I just, sort of given the magnitude of that, just take the opportunity as we end the COVID era, just to thank staff for the leadership staff for stepping up. And there's hundreds and hundreds of HSA employees who played a role. And it was a time of significant uncertainty and fear and everything else, and embarking on initiatives we've never undertaken before, including renting almost 3,000 hotel rooms and supervising and managing them, and staff really stepped up. So I just want to take this opportunity to thank everyone who played a role, many of whom are in this room. In our programs, in our Medi-Cal division, the State Department of Healthcare Services introduced its new 5-year strategic plan. And the purpose statement being provide equitable access to quality healthcare leading to a healthy California for all. And the reason I'm mentioning it is there are 5 key initiatives in the plan. One of them being, I'll just quote from the plan, expanding comprehensive health coverage to all income eligible Californians, regardless of immigration status, to strengthen our state's entire health system. And I raise that obviously because we're the ones who certify the eligibility for everyone on Medi-Cal. It's over 250,000 people in San Francisco. And the expansion to the undocumented population means that every individual, irrespective of income, is eligible for health insurance in San Francisco. And so and we have a huge role, obviously, to play in that. Speaking of,
Is that the San Francisco
250,000 in San Francisco, yeah.
documented, going entitled to healthcare in the rest of South?
Statewide, yes. And then related to Medi-Cal, as you know, the continuous coverage unwind, meaning the COVID exemptions the allowance under COVID to keep people on Medi-Cal and not have them recertify, that ended, and it's called the continuous coverage unwinding. For June, meaning people have to submit their paperwork to certify that they are still eligible, and we do basically 1/12 of the caseload each month. For June, more than 81% of Medi-Cal recipients statewide did return their information packet, which, our concern was, households get used to being on Medi-Cal, not having to do anything, not having to submit paperwork, and that because they're used to that, they'd see it, they wouldn't return it, they'd ignore it. It appears to be sort of the 80% return rate is really close to what the return rate of those packets were prior to COVID. So sort of that, the 20% who don't, a lot of them have found health insurance on their own, they become employed, they're no longer eligible, they moved, they passed. And so that's, seeing that we're sort of mirroring pre-COVID, it makes pretty good comfort level that we're still reaching everyone who needs, not everyone, most folks who are receiving Medi-Cal. It's also important to note that if households don't submit their paperwork, they do have, I believe it's 60 days to cure that, and so they can get their Medi-Cal restored should they have lost their coverage for failure to return paperwork. In our divisions, in our workforce development division, we've been really pushing Jobs Now enrollments. We're really trying to get the word out more on Jobs Now. Our numbers in our subsidized employment programs have gone down. They went down during COVID for obvious reasons, but they haven't really crept back up as significantly as we would have hoped. So we continue to have in-person hiring events for job seekers and for employers who hire our Jobs Now candidates, and particularly in our public service trainee program. stepped up the outreach efforts, attending a lot of job fairs, and they're starting to translate into increased Jobs Now enrollment numbers, which is great. I get sent photos of our sort of orientation sessions over at 3120, 3119 Mission, and the rooms have been full. So that's really good. Good news, not only for us, but for other city departments who host our public service trainees, Department of Public Works, Rec and Park, Public Health, and others. Just to mention on some new funding that we received recently, spoke with President Khan a bit about this already. We received $1.4 million of a base allocation from the state to support Ukrainian refugees in San Francisco. And the 1.4 is to help them, it's basically to support their housing. So rental subsidies, helping pay utilities for a period of time as they settle in San Francisco and sort of get on their feet and find work or find a way to pay for their own housing after we are helping support them. We did release an RFP to select a community-based provider to do the enrollments and the work around getting funding to Ukrainian households. And I had a chance to meet with the Ukrainian Consul General and his staff as sort of a referral source. As it was interesting, as I went to the consulate, there was a line down the hall of recent Ukrainian folks who just recently arrived from Ukraine, and so having this resource for them will certainly help them assist families who are trying to resettle here. In Family and Children's Services, we had our second annual Service Provider Fair held just last week. It's really a way for our family and children's staff to meet the community-based providers who serve our clients. This year we had 23 agencies, reps from 23 agencies attend. Entities, family resource centers, domestic violence providers, services for the deaf community, sort of anyone who's touching our kids and families who are engaged in our child welfare system. All the providers are from San Francisco. So it's just a way to sort of help make that connection. It's not just a contract on a piece of paper. It's really make those personal connections as we're, as a community trying to serve kids and families who need our support and help. And then sort of similar to that, we continue to build collaborations with providers in the healthcare world in our front end, our emergency response for child welfare, child protective services, working with UCSF, CPMC, Team Lily, which is a program at Zuckerberg that serves pregnant and parenting women who have substance use disorder, substance use challenges. Develop MOUs with them to really sort of have a mutual understanding on when families and kids should be referred to us for support, or when there's concerns about newborns or young children who are at risk of abuse or neglect. Sort of, again, it's a way to make connections that are important, that where hospitals are comfortable in calling us for help, rather than being fearful of a child protective service response, right? Knowing that we're not going to come out, and disrupt a family that's functioning well, that we're coming out and we're bringing supports and we're bringing assistance to moms who might be struggling and kids who might be at risk. So also continue to collaborate at the front end with our Child Advocacy Center, the District Attorney, the SFPD's Special Victims Unit, helping train them on forensic interviewing and in a way that's really trauma informed, tries to minimize the trauma that kids have already sort of experienced being victims of abuse. So it's just reporting to you because it's a really, I think, a good proactive way for us in our Child Protective Service emergency response team to be connected with folks before emergencies happen. And then I was told by staff that an employee who you have seen a lot here in this room over the last many years, Johanna Gendelman, it's her last commission meeting today. She's retiring. He's hiding. And I was on a personal and professional note. I think Johanna and I started at the agency around the same time. Yeah, a few months ahead of her. So I've had the opportunity to work with Johanna for over 2 decades, and consummate professional, really gets stuff done. sometimes he's a squeaky wheel in a good way for us to pave the way to have staff in contracts and other areas be able to do the work better. So, Johanna, thank you for your over 2 decades of service. Enjoy your retirement. And I will conclude with that. Happy to answer any questions.
Is there any public comment on what Mr. Rohr had to say? Thank you. Item 6 on the agenda is the employee of the month. And the August employee of the month is Juan Cortez. Juan is a CalWorks employment specialist. As an employment specialist with CalWorks Welfare to Work section, Juan plays a very important role in the Families Rising program. He provides new parents and families with a wraparound service as part of, sorry. I don't need to start over. We know it's Juan. I will start over that one sentence. As an employment specialist for CalWorks Welfare to Work section, Juan plays a very important role in the Families Rising program. He provides new parents and families with wraparound services as part of a multidisciplinary team of service providers. Juan is an excellent case manager for his clients, engaging them at every step in their self-sufficiency journey with dignity and respect. He consistently receives positive reviews from clients who describe him as thoughtful, caring, and a reliable case manager, always willing to go the extra mile to ensure their services and benefits are provided in an efficient and professional manner. Juan makes it a point to connect with his clients, especially the children. He buys his young clients reading and coloring books with his own money so that they have their own brand new books and can share in the joy of reading. In addition to his work with Families Rising, Juan represents the Welfare to Work program in a project entitled Looking for the Right Words, which aligns language and messaging with the agency's mission. Juan has proven to be selfless provider and tireless advocate for CalWorks families over the span of more than 15 years with our agency. Excuse me. During the pandemic, Juan was on site 5 days a week, even though he now has the option to telecommunicate 2 days per week. Juan is at the office here at 170 Otis every day, serving clients and supporting the CalWorks team. He is usually the earliest worker on site and rarely calls in sick when scheduled for service duty. Juan is well liked by all of his coworkers and managers and is often relied upon for his knowledge and experience as it pertains to client services and CalWorks policies and procedures. No matter who asks for help, Juan is continually steps up with a smile. He goes above and beyond to help coworkers by always taking time to answer questions while offering support and guidance. Not only does he step in to answer questions, Juan will then stick around and make sure his coworkers and clients are set up for success. Juan is viewed as a role model to his clients and peers alike for his constant professionalism and dedication, mission, and values. Thank you for your hard work and contributions, Juan, and congratulations. Finance from Mr. Rohr.
I'm really pleased that we get to honor someone from the Families Rising program, which used to be called Project 500. And I say that because I was in the room when Project 500 was the brainchild of Mary Lee, and really a legacy of Mary Lee. We were in a room several department heads talking about issues with families in the southeast part of the city and girls with poverty. And Mary looked at me and said, can't we just get 500 families out of poverty? Just focus on 500 families. And that was born Project 500, which we now call Families Rising. And sort of it was a blank slate along with money from the mayor. And he left really the agency to craft sort of our own approach. And what we learned very quickly was when you're working with families who've been in poverty for a long time, there's no simple straight line or roadmap that works for everyone. Every family has different circumstances. No single regulation is going to match. And so it really took a lot of creativity, flexibility to respond in an effective way for our families. And from hearing what you just read, that sounds like it really embodies that, being flexible, being supportive, sort of whatever it takes to help our families and colleagues. And so very pleased that we could honor you this month, and congratulations, Mom.
Thank you, Mr. President. Supervising Commissioners, yes. Director Robert. Good morning, everyone. It's very grateful for the recognition. As I want to thank Commissioners, Director Robert, Trinity, Tony, and Judy, David, of course, Damon and Susan, they are across the street, interacting with Nellis. One also thanks the community partners that assisted our but I just want to thank our support as all of you know, the work we do here is very, very important. And it is a team effort. It is with the support of eligibility workers, social workers, employment specialists, and clerical staff that we are able to do this work and support our participants. I would like to share this award with all of you because it's not really just me. And I want to thank you all. I wouldn't be able to do it without your help. Thank you.
So you can stay or you can leave. It's totally up to you. So, yep.
Once again, thank you, Ron.
Thank you.
Item 7 on the agenda is the consent calendar. Do any of the commissioners want to remove an item for individual discussion? Nope. Is there any public comment?
Raise your hand or start the public comment on item 7. Nobody in the queue. You can.
Item 7, the consent calendar.
So moved.
All in favor?
Aye.
So moved. Item 8A is a request for consideration and possible action regarding the fiscal year 2023-2024 Human Service Commission Annual Statement of Purpose, presented by Rose Johns.
Testing. Good morning, commissioners. You can hear me? All right. Good morning. My name is Rose Johns. I'm the Director of Planning for the Human Services Agency. I think some of you knew my predecessor, Dan Kelly, who retired a couple years ago. My first time presenting for you. Nice to see you this morning. I'm here today to present the statement of purpose for the Department of Benefits and Family Support. I'm seeking your approval of this statement today. As you may recall, the city charter requires that all departments maintain a statement of purpose that is presented for review and approval by their commission each year. This document outlines the department's primary programs, the statutory authority, and the purpose of the department's services. We update the statement when there are significant changes to our work. The statement that you have before you today has not changed since last year. This is the same language that you approved last year. When we bring this before you, we also like to take the opportunity to highlight a bit more about the work that we're doing and how these programs tie to our department's mission and our vision for San Francisco. So with your permission, I'd like to spend a few more minutes with you today. Okay. So Director Moore mentioned that state department, I think you said Healthcare Services recently published a 5-year strategic plan. We did any one of those last year as well. So last year, Deputy Director Susie Smith came before you to present HSA's strategic plan. Something notable about our strategic plan is that it's the first ever cross-departmental plan that represents both BFS and the Department of Disability and Aging Services. Our work is shaped by 5 goals in this plan: equity, inclusion, and accessibility, strong workforce and collaboration, employment and economic security, health and well-being, and safety and care. BFS programs outlined in our statement of purpose are key drivers towards these goals. And this year, I'd like to highlight some ways we're kind of thinking outside the box and going beyond our direct mandate to support the people of San Francisco. So for example, with regard to our goal on equity, inclusion, and accessibility, we are launching an immigrant outreach pilot, and I think you've approved some of those contracts here. Through this initiative, we're testing messaging and outreach strategies to make sure that all who are eligible are aware of our services and how to access them. We're focusing on the Spanish-speaking and Chinese-speaking populations to address concerns, misperceptions about our services, and lower barriers to support movement. Another goal in our strategic plan that I just mentioned is employment and economic support. And one program that exemplifies this priority is our diaper bank. Through the diaper bank, we provide free monthly supply of diapers to households in the public benefit programs listed in our statement of purpose, to households with children under the age of 3. In the last year, we massively expanded our reach by including now families enrolled in Medi-Cal. We've reached more than 4,000 kids in San Francisco and distributed our 5 millionth diaper in the last year, which is a big milestone for us. And then finally, I wanted to highlight within our goal of safety and care, something about our child welfare program. Child welfare is known for its crisis, its response in moments of crisis. But our child welfare program teams really work to also support the long-term stability of children, youth, and families in San Francisco. And a key piece of that in our expensive city is housing. So in the last year, our FCS, Family and Children Services team, connected 39 young adult foster youth and 14 families with housing vouchers. An additional 98 youth who emancipated from foster care at age 21 were provided with a housing stipend of over $1,000 a month for 18 months to help support their housing stability and ease them out of care. These are just a few examples of ways that the programs listed in our statement of purpose are working to advance our mission and vision for a San Francisco where all people, all ages, all income levels are able to succeed. With that, I'll stop. Happy to answer any questions that you may have.
Questions from the commission? Is there any public comment?
Raise your hand, start reading for.
Is there a motion to approve item 8A?
Second.
All in favor?
Aye.
So moved. Thank you. Item 8B is a request to approve the 59th County Letter of Agreement with CDSS presented by Joseph Wong.
Good morning, Commissioners. This is okay. Hi, I'm Joseph Wong. I'm the Finance Director for the Human Services Agency. And I'm here this morning to request authorization to enter into the agreement with California Social Services to continue to serve as the 59th county for the state. Basically, when the state realignment funds, there were certain contracts that the state administered for all 58 counties that required to realignment funding for these contracts. But the state is unable. Sorry, this is sort of just distracting. It's an echo, yeah. So basically, the state is unable to receive realignment funds directly. It is competitive for the 59th county to receive the funds from these state contracts. They're at FDA counties. And so this happened back in 2014. And the first couple of years, Seneca service with 59th county, but then they declined. So then the state approached us. And so we've been the 59th county for the past 8 years, I believe. So this will be our 9th year coming up. So I've been coming in front of you every year for the past 9 years now, or 8 years, to request authorization to enter into this contract. And so this contract actually is $0 to us. Basically what happens is we receive the realignment funds directly from the state, and then the state bills us and we pay them for the services. So basically we're not out any money. All we do is administer the funds. And so I'm here today to ask you to approve us continuing to do this service for the state. And I'm here to answer any questions you may have.
Please. Comment. Is there any public comment? Is there a motion to approve 8B?
Second.
All in favor?
Aye.
So moved. Item 8C is the annual hearing regarding the Homelessness and Supportive Housing Fund presented by Justin Chan.
Good morning, Commissioners and Director Rohr. I'm Justin Chan, Principal Budget Analyst for the Human Services Agency. The Homelessness and Supportive Housing Fund pays for housing services for homeless CAT clients through savings resulting from the implementation of CARE Act. The ordinance requires that on an annual basis, the Human Services Agency report how accurate its projected savings were for the year. The savings from CARE Cash that support this fund result from two sources. One is the reduction in homeless CAP caseload from a baseline of 3,000 cases, and the other is reduced grant amounts for homeless CAP recipients who are offered shelter. Since HSA administers the CAP program, we are responsible for calculating these savings. We transfer these savings at the end of each fiscal year into the Homelessness and Supportive Housing Fund, And the Department of Homelessness and Supportive Housing then uses these funds to administer housing and services for these clients. The savings for fiscal year 22-23 came to 17.5 million, which was around 1.3 million less than budgeted. This outcome was driven by a larger than expected monthly homeless cap caseload during the fiscal year. For fiscal year 23-24, the Care Fund budget is set at 22.4 million. The homeless cap caseload is projected to be lower than it was last fiscal year. And starting in October 2023, the monthly cap grant will increase by 3.6%, and that will increase the maximum pool of savings that the fund could generate. HSA staff recommends that the Commission adopt findings regarding the fiscal year 22-23 homelessness and supportive housing savings and transmit them to the Board of Supervisors and Office of the Controller. I am happy to answer any questions. Thank you.
Commission?
I have a question, not so much on this specifics, but how does this interface with the Department of Homeless?
I mean, why is it our budget versus their budget, I guess is the question.
Yes, I think that is we are separate departments. So originally, when the homeless services were under HSA, we administered both the CAP program and homeless services. So we were generating the savings for our own usage because we also administered housing and homeless services. But now that those services are under a separate department, they are responsible for administering these types of services, shelter, housing, other supports. And so since we still have the CAP program, we still generate the savings, but they have to administer the services using these dollars. So that's what we transfer.
The Human Services Commission every month. So even though, or every year, excuse me, even though they administer the money now, yeah.
And to the Board of Supervisors.
Is there any public comment?
Please, star 3 or raise your hand. For item 8C. No public comment.
So moved.
All in favor?
Aye.
Item 8D is a request to enter into a new grant agreement with Safe and Sound, presented by Karina Zhang.
Morning, everyone. My name is Karina Zhang. I am a program support analyst with the Family and Children's Services. I'm here today to request authorization to enter into a new grant with Safe and Sound for the period of September 1st, 2023 to June 30th, 2024 in an amount of $109,415 plus a 10% contingency for a total amount not to exceed $120,357. The purpose of this grant is to provide consultation, technical assistance, facilitation, and report writing services in order for San Francisco to complete the mandated county self-assessment. The county self-assessment is an important part of California's Child and Family Services Review, CFSR, which is an accountability process for child welfare and juvenile probation department. CFSR is a 5-year continuous quality improvement process that examines the entire continuum of care from prevention through aftercare. Much like the CFSR looks at outcome data and peer review and focus group results to assess the county's ability to achieve safety, permanency, and well-being for children and families. Safe and Sound has been designated by the Board of Supervisors as the county's Child Abuse Council in 1982 and has been an integral partner for FCS since then. This time, Safe and Sound will partner with Hay Consulting who completed this work for the county in 2019 to support the county in completing the new round of county self-assessment in 2024. Partnering with Hain Consulting, Safe and Sound will provide project management support, conduct research and analysis on FCS data, facilitate stakeholder meetings and focus groups, facilitate a week-long peer review process, and produce written reports to support the completion of all the state and data reports associated with the CFSR process. And the Chief Policy Officer from Safe and Sound, Jenny Perlman, is with us here online today, and we will be happy to answer any questions you might have.
Are there any comments from members of the commission? Hearing none, is there any,
Yep, one moment, please. Star 3 or raise your hand for item 8D, safe and sound. Okay, no public comment. Thank you.
yeah, okay. Is there a motion to approve item 8D?
So moved.
Second.
All in favor?
Aye.
So moved. Thank you. Item 8E is a request to enter into a new grant agreement with the Reba Juntos presented by Andy Beasley Hagler.
Good morning, President Khan and Commissioners. My name is Andy Beatley Hegler, and I'm the Immigrant and Refugee Services Coordinator here at HSA in the Community Services Division. Department of Benefits and Family Support requests authorization to enter into a new grant with Arriba Juntos for the provision of refugee benefits linkages for the period of October 1st, 2023 to September 30th, 2027, in the amount of $381,880. That's a 10% contingency for a total amount not to exceed $420,068. The purpose of the grant is to link refugees, asylees, trafficking victims, and other immigrant arrivals to the San Francisco area with local services and benefits that can lead to self-sufficiency. Recent world events, most notably the war in Ukraine and the end of Title 42 here in the U.S., have led to an influx of immigrant arrivals in San Francisco, which has pushed HSA's Refugee Cash Assistance, or RCA, caseload from around 20 to over 200 clients. As the war continues and the backlog of asylum applicants at the U.S. southern border remains high, HSA anticipates sustained elevated numbers of immigrant arrivals into the city. This contract seeks to link these individuals to available refugee and self-sufficiency resources and services available throughout San Francisco County. The grantee will identify eligible clients and make service and benefits referrals tailored to the client's needs. These services will include language education and vocational training programs offered by various agencies in the Bay Area. Clients will also be referred to HSA intake for screening and possible enrollment in the RCA, CalWorks, CalFresh, and Medi-Cal programs. The grantee will connect clients with workshops on social adjustment, cultural orientation, citizenship activities, and personal finance, among other services. Grantee will form a minimum of 10 benefits linkage events per month to connect with the refugee and immigrant community. And over an annual period, 25 individuals referred through benefits linkages will enroll into HSA services. I'm available to answer questions regarding the services. Representing for Arriba Juntos are Gladys Garcia, Director of Programs, Patricia Melgar, Training Coordinator, and Andy E, Programs Assistant. Thank you.
Are there any comments from members of the commission? Hearing none, is there any public comment?
Star 3 or raise your hand for item 8E, Arriba Juntos contract. Okay, no.
And I ask for a motion to approve item 8E.
Approved. Second.
All in favor?
Aye.
So moved. Item 8F is a request to enter into a new grant agreement with multiple providers presented by Cindy Lynn.
Kind of put this way down. Good morning, commissioners. I'm Cindy Lynn, manager of the citywide food access team here at HSA. Today, I'm here to seek authorization to enter into new grant agreements with multiple grantees for grants totaling $5,580,000 for the current fiscal year and $3,627,000 for the next fiscal year. The combined amount is $920,700 plus 10% contingency, sorry, $9,207,000 plus 10% contingency for a not to exceed amount of $10,127,000. These grants are for the term of September 1st, 2023 through June 30th of 2025. I believe in past months, Executive Director Aurora mentioned that the budget for the next 2 years of our food access work is slated to decrease from $20 million this year to $10 million in the next. So as a result, these grants that are presented today reflect a decrease in from year 1 to year 2 in order to meet our budget constraints in year 2. Nonetheless, we are able to enter into new grant agreements with our nonprofit partners in order to provide grocery programs that center dignity, quality, and cultural relevance to low-income San Franciscans. RFP 1091 was released in early June in order to seek proposals from community-based organizations who have the capacity and interest to serve low-income residents in the highest need zip codes with free grocery services that are culturally tailored to the populations they serve. Today, we have 9 grants for your consideration. I will be returning next month with additional grantees as we are actively negotiating additional grants. The grant agreements for your consideration today are with Bay Area Community Resources to serve the OMI area in zip codes 94112 and 94132. Bayanihan Equity Center to serve the 94103 Sona area. Booker T. Washington Community Services Center to serve the 94115 Fillmore Hayes Valley area. Curry Senior Center to serve the Tenderloin area. Farming Hope to also serve the Tenderloin area. A organization known as From the Heart to serve the 94124 Baby Hunters Point area. Homey to serve the 94110 Mission area. Tenderloin Neighborhood Development Center to serve also the 94102 Tenderloin area, and the Richmond Neighborhood Center to serve the Richmond district in our city. I believe we have representatives from each organization here today with us, ready to answer any questions you may have. But before we get to that, I would like to introduce Shakira Simley, the Executive Director of Booker T. Washington Community Services, who would like to share a few words with the Commission.
Elizabeth, do we need to vote on each item? Okay, right. Go right ahead. Thank you.
Good morning, President Khan, Vice President McCray Jr., Director Rohr, and fellow HSA commissioners and leadership. My name is Shakira Simley. I'm the Executive Director for the Booker T. Washington Community Service Center, which is the city's oldest Black-led and serving organization with over 103 years of service to San Francisco. Thank you so much for the opportunity today to speak from my heart and expertise as an advocate with over 20 years of experience in food equity and community development. I come to you today as I'm driven to serve based on the love and light from my grandmother, Minnie English Shabazz. Grandma Minnie was the beloved matriarch of our family, and she was stolen from us after a brief and brutal battle with colon cancer at the age of 63. An illness that ravaged her because she did not have access to the fresh and quality foods that would help heal her. I remember standing helplessly while grocery shopping with a list from her doctor in a local bodega, looking at an array of stale and sodium and sugar-laden options, knowing that her diagnosis was ultimately a death sentence. She could not make a healthy choice, even if she wanted to. From that point, I vowed that my work and service would prevent this from happening to other Black and poor families. The root causes of chronic disease are more nuanced than poor choices of an individual. We cannot expect people to just eat healthy and exercise. We must consider how their behaviors are shaped by their social, physical, and political environments. And this is why this program and funding in front of you today is so important. The HSA Grocery Access Program helps radically shift neighborhoods and environments so that our beloved community can nourish themselves with dignity, culture, and respect in mind. This powerful program takes a holistic approach to how we can feed and empower San Franciscans across multiple districts and key demographics. This innovative program ensures that thousands of our most vulnerable community members, such as low-income communities of color, families with children, seniors, and people with disabilities, transitional age foster youth, pregnant people, immigrants, and the queer community can access high-quality, culture-appropriated fresh food right in their neighborhood from people that know them and the people that they trust. This creative program also allows fresh, good food to serve as an entry point to an array of critical social services, whether it be free childcare, a meaningful job training opportunity, mental health services, or housing assistance. This incredible list of hardworking service providers in front of you today that I share with tackle more than just hunger. They are powerful anchors in troubled seas. This is the case at Booker T. Washington. Every week, we're able to source organic, local produce and pantry items from Black and brown farmers and local producers and feed hundreds of people with choice and dignity. It allows me to pay fair local living wages to our staff, chefs, and producers to keep our Black and brown community here in San Francisco. We pair our food justice program with educational and cultural opportunities, ensuring that children can learn on a full stomach, our seniors can age more healthfully, and our working parents have solid, consistent support. However, right now in San Francisco, we're in a crisis. Before the pandemic, 1 in 4 San Franciscans were reported as food insecure. Now we have reason to believe it's closer to 1 in 3. Since the pandemic, food support signups have increased drastically with a 40% increase in CalFresh programs, 41% increase in WIC programs, and 1 in 8 residents and San Franciscans accessing community food programs. Nationwide, inflation continues to increase. It has been at its highest in 20 years, while climate change has devastated our local farmers and food chain through prolonged drought, killer wildfires, and unprecedented floods. Further, with the expiration of federal emergency allotments, the rising price of food, now is the time to ensure that city leadership prioritizes our right to good, fresh, healthy, and just food. And your decision today helps do just that. This work doesn't happen alone. I'm proud to work alongside a community-based BIPOC coalition called FACTS, which is composed of 24 organizations established to ensure consistent and equitable access to food in San Francisco. And we believe that our food system can be changed with meaningful collaboration with the city. We uplift mutual aid, we all share resources, and we affirm that we're responsible for one another. We're responsible to the land and the rural communities who labor for our city's benefit. We will continue to advocate for funding locally and statewide, and we'll feed our communities, but your partnership today is vital for this to continue. This landmark funding is a positive step in the right direction. I want to publicly thank the hard work of the CFAT team and the HSA staff and their tireless commitment to make sure that this program is a reality. Thank you. We cannot scale back on those essential food supports for our community, and given the timeline of this funding, we face a cliff in about 2 years. So on behalf of our community leaders, we urge HSA leadership to continue to work with us. Let's secure the funding commitment today and then unite to find long-term sustainable solutions to fund these community-based initiatives for the long term. In closing, I like to have a saying, everybody eats. Everybody eats. This is a basic human rights issue. Let's make sure that everyone can eat and live well in San Francisco. I ask humbly that you allow me to make my Grandma Minnie proud. The resilience of our communities and future of our city depends on it. Thank you very much.
Well, commissioners, I'm happy to take any additional questions you may have.
Are there any questions from members of the commission? Is there any public comment?
take public comment at this time for all of the grant recipients. So everyone listed for 8F. Thank you.
Hi, Commissioners. Thank you. My name is Haley Nielsen. I'm the Development Director for Farming Hope, one of the CFAT grantees for this neighborhood grocery access. We work with folks in the Tenderloin, one of the most difficult neighborhoods in San Francisco for folks. And we have this beautiful community that comes in to get groceries 3 times a week and also access our other services. We have a community dinner on Tuesdays and Wednesdays. And after that dinner, folks are able to take groceries home that are funded through this program. So we're very, very grateful for this funding. And I'm not going to say it as well as our clients will. So I wanted to read a couple of notes from folks who heard that we're coming today for this meeting. And this is just a snippet. We had 74 responses when we asked for things to take to this meeting. So it's really a big deal for our community. Thank you for the effort you guys are doing. We are happy to have a food pantry that cares about us. Everything is clean, organized, and has easy access to get our groceries home. Congratulations and thank you. We are grateful for the produce and the cooked meals we get twice a week. Due to the high cost of everything, it has made a huge difference on the days we don't have to worry about dinner. The produce we get from all of the awesome tables, we use it all week. We're so appreciative and grateful for the grand blessings. And this one's my favorite. This is from a client, Julie. I'm a single mother raising a 3-year-old son in the beautiful city of San Francisco. As we all know, the city can be quite expensive, making it challenging to make ends meet. The high prices of food make it even more difficult to provide a healthy diet for my son. However, thanks to the food program, I have been able to afford nutritious meals and to save money to pay my bills and rent. I've been a part of this program for a while and it has been a tremendous help. One of the key offerings of the program is a healthy food pantry that is available 3 times a week. The pantry is stocked with an abundance of fresh fruits and vegetables, allowing me to provide a balanced and nourishing diet for my son. Additionally, the program provides opportunity to enjoy a healthy dinner with the community once a week, fostering a sense of togetherness and support. If it weren't for this program, I would struggle to afford food for myself and my son. I would be forced to make difficult choices and prioritize cheaper, less nutritious options. The program's range of fruits and vegetables goes beyond what I could afford, introducing me to new varieties that I would have never had a chance to try otherwise. The impact of this program on my family is immeasurable. It has given us a sense of security and relief in a time when families face so many financial hardships. In conclusion, the food program has been a lifeline for my family, ensuring that we have access to healthy, nourishing food despite our financial constraints. It has been the reason I can stay in San Francisco. I'm truly grateful for the program's existence. Thank you so much. That's Julie. So thank you, everyone.
Is there any other comment? Thank you.
Well, good morning, everyone. Good morning, Commissioner, President, everyone here, who's prepared to support. Thank you so much. I don't have a lot to say. I'll start there. My name is Micah Pinkston. I represent From the Heart, and I cover Bayview Hunters Point Hill. What I will say is this: I educate our community to live a natural and healthy lifestyle by introducing our community to organic produce, to natural living, holistic healing, and just things that we've never had. We don't understand because we've always been giving foods that were unhealthy for us. And I don't want to knock anyone down, but specifically old food, malnutritionist food, it's just horrible. And when I provide the community with these organic groceries, I also provide recipes. So teaching them how to make a salad, how to make soup, how to make things without meat. how to just be healthy. And something that, again, in our culture, in our community, we don't have. And we have to learn, and it starts now. It actually started for us on the Hill before the pandemic in 2018. And then when the pandemic came, I was able to just take off and educate. And it's gone a really long way. It's to the point to where a lot of our multifamilies and elders, they are looking for these groceries. They need them. They understand now how to eat them. They understand how to cook them. They understand how important it is to be healthy opposed to receiving cup of noodles and microwave foods, processed foods, and things of those sorts. So that's really all I have to say is that in my community, From the Heart educates to live a healthy and natural lifestyle. And your vote today and approval today will either make us or break us. So thank you, and you guys have a blessing.
I'll try to keep this brief. My name is Gabriela Alemán. I'm the director of La Ofrenda. La Ofrenda is a collaborative market between one of the grantees, HOMI, and HOMI subcontractor Mission Meals Coalition. HOMI is a violence prevention program, and Mission Meals Coalition is a mutual aid collective that started during the pandemic and is well known for our free community fridge. Together, we, like I said, have opened this community market. The Mission District has been one of the most impacted districts overall. During the pandemic, and just generally institutionally, we have a lot of marginalized communities that live in the district. We're located on 16th and Mission, also one of the more disenfranchised areas of the District of D9, of the Lower Mission. Our market and the work that we do has been such a crucial access point for our families. We're also servicing a high volume of Central and South American immigrants that are coming and seeking refuge in San Francisco. We strongly believe that food is violence prevention. Food is a human right. Everyone eats, like Shakira said earlier. And we, as service providers, we strongly believe that we can't service people's social needs without addressing their human needs first. And so the work and the support that we've received from this commission and from HSA has been incredibly crucial to continue this work. We're very proud that our subcontractors and other small mutual aid groups as well have been able to sustain their work that has been so crucial and that was needed before the pandemic, but that was a lifeline for so many families that we service. So thank you so much. And yeah, thank you.
Is there any other comment? Any audience? I'm just seeing to online. Okay, we can close public comment at this time.
Like, I know, it makes a big difference to us that you're from, directly to providers, very helpful, you know, I would, what you could say, well,
Thank you. Thank you.
So, is there a motion to approve item 8F-1?
I'll move that the commission authorize the new grant agreement for the Bay Area Community Resources.
Second.
All in favor?
Aye.
So moved.
Same motion for the Bayanian Equity Center. I said that right?
Second.
All in favor? Aye.
Aye.
So moved.
Same motion for the Booker T. Washington Community Service Center.
All in favor?
Aye.
Same motion for the Curry Senior Center.
Aye.
Is there a second? All in favor?
Aye.
Same motion for Farming Hope.
Second. Second.
All in favor?
Aye.
Same motion for From the Heart.
Second.
All in favor?
Aye.
Same motion for HOMI.
All in
Second.
All in favor?
Aye.
Same motion for the Tenderloin Neighborhood Development Corporation.
Second.
All in favor?
Aye.
And the same motion for the Richmond Neighborhood Center.
Second.
All in favor?
Aye.
Thank you.
Thank you.
Item 8G is a request to modify the existing grant agreement with San Francisco Marin Food Bank presented by Cindy Lynn.
I am here to seek authorization to modify an existing grant agreement with the SF Marin Food Bank for the period of July 1st, 2023 through June 30th, 2024, in the amount of $6 million plus a 10% contingency for a not to exceed amount of $17,828,328. The purpose of this grant is to distribute groceries to San Franciscans throughout the city, focusing on high-need neighborhoods. As a reminder, this program that we're supporting is known as the pop-up pantries. These are the large-scale pantries that you might have seen throughout San Francisco at the height of the pandemic. They had to operate outdoors for safety reasons, and we've been supporting this model for some time. So we're here again with a modification request to go through this fiscal year. This modification adds $6 million to the grant and also brings the duration through June 30th of 2024. This modification will fund the distribution of an additional 354,000 units of groceries and serve at least 6,000 unduplicated participants during the grant term. Each of these, what we call units, they always consist of fresh fruits and vegetables and proteins and grains. I have with me here today Mr. John Brooks, who is the Chief Programs Officer of the Food Bank, to answer any questions you may have.
Are there any questions from members of the commission?
Public comment, *3, raise your hand, or anyone in the board.
Motion to approve.
Second.
All in favor?
Aye.
So moved.
Thank you very much.
Item 9 is general public comment. Is there any public comment?
At this time, we'll take general comment about anything pertaining to the agency. *3, raise your hand. Oh, okay.
Meeting is adjourned.